All right, welcome back to ABA exam review and the continuation of our BCBA practice exam series where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please subscribe, share, and like. Check out behavioranalyststudy.com for all of our study materials. When you pass, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. On the first day of class, a math teacher explains to her students what to expect for the coming year. They will start with the basics, but then quickly move into more advanced areas of calculus. The teacher then hands out a brief quiz, which he will use to identify what areas the majority of the class may have trouble with to start. What is the primary purpose of the quiz? This question is a good example of why we don't want to overthink things on our exam. Sometimes the question is just very straightforward with a very straightforward answer. So if you're evaluating the information given, what would we think the primary purpose is of the quiz? Because we know that the math teacher hands out the quiz to identify areas where the class may have trouble with. So what is she trying to do? Well, she's trying to identify problem areas. So if we look at A, to identify the stimuli in the classroom that will act as motivators for the student, well, it isn't a preference assessment, so A doesn't fit. B, evaluate the student's ability to perform necessary functional skills. The quiz isn't about functional skills, it's about deficits in calculus. C, evaluate the student's strengths. Well, she's looking at what they're struggling with, not what they're good at. So what she wants to know is to assess the student's specific needs in the classroom. This is a needs assessment. That is the primary purpose of the quiz. Again, a very straightforward question with a straightforward answer. Sometimes you will get those. Don't overthink it. Pick the right answer. Move on. Ethan has started to work with more and more children with dual diagnoses. For example, children may have both autism and social anxiety disorder. Ethan, a behavior analyst, is not necessarily trained or comfortable working with some of these additional conditions. What should Ethan not do given this information? So let's read carefully, right? Important word is not. What is Ethan not going to do given the information? And what information are we given? Well, we know Ethan is working with more dual diagnoses, so children with multiple diagnoses like autism and social anxiety disorder. Ethan is not trained or comfortable with some of these additional conditions. So in that case, what should Ethan not do? He's not comfortable or trained, but he's going to be working more and more with these kids. A, seek out continuing education classes that focus on working with dual diagnoses. That would be a good idea. That is something Ethan should likely do. B, attempt to find a mentor or professional who can offer advice and training. That would be a great idea. If he can find someone, if he's dealing with a lot of kids with ADHD and there's a professional he can work with, that would be a fantastic idea. C, read academic articles on dual diagnoses. Absolutely. You should be reading academic and scientific journals on our area. So that leaves us with D. Focus on what he knows and leave what he doesn't to other professionals on the team. Now, while we do want to work within our competence, we can't stay still. We can't remain stagnant. If Ethan is going to be having more and more children with dual diagnoses, Ethan has to adapt. He can't just continue to write off each client who doesn't just have, let's say, autism. It's not feasible. It's not practical. We must always be growing. We must always be continuing our education and becoming better, more knowledgeable analysts. So Ethan needs to focus on what he knows, leave what he doesn't, or what Ethan should not do, excuse me, is focus on what he knows and leave what he doesn't to the other professionals on the team. You're contacted one day by an occupational therapist who you have never spoken to before and who requests access to your client's treatment plan. You've worked with this client for only a couple of weeks up to this point, but are confident that your plan is solid. At the initial assessment, stakeholders did sign consent forms, which allow other team members access to your treatment plans. What should you do? Let's read carefully here, right? We always attack the question first. So this is obviously a consent privacy question because this OT reached out to you. You've never spoken to them, but they want the client's treatment plan. You've been with the client a couple of weeks and the stakeholders did sign consent forms for team members. However, you've never spoken to this occupational therapist. Do we know they're part of the team? It's unclear. So before giving them access, what should you do? A, provide access since consent was already given. Consent was given for team members. You've never spoken to this person. So just because they ask for the plan and you have consent for team members doesn't mean you should just give out information to anyone. B, check with stakeholders regarding the occupational therapist role. Yes, it's a simple request. You ask the parents, is this a team member? Can I give them access? They say yes, give them access. C, refuse access if you have the right to withhold your treatment plan from anyone. Not necessarily. If the stakeholders want you to share your treatment plan and it's part of the consent forms, then you should share your treatment plan with the OT. The stakeholders are part of that plan as well. D, meet with the occupational therapist first and then decide what you should do. Well, the occupational therapist is not who you need to meet with. You need to meet with the stakeholders and verify that the OT can have access to these plans. It is the assistant general manager's job to check inventory each morning at the restaurant. The assistant goes through and tracks how many of each item is needed or expired. Randomly, the general manager will also check inventory twice a week and measure the same thing as the assistant general manager. The random checks by the general manager help most with what aspect of data based on this information. So let's think about this behavior analytically. If we have a situation where we have the assistant general manager going through expired or needed items, and then also a general manager doing the same thing and measuring the same thing, what do we consider that? Well, we consider that some inter-observer data or inter-observer agreement data collection. It's like me and you taking the same data and comparing our data, IOA. So the question becomes, what aspect of data does IOA help with the most? Accuracy, reliability, validity, or believability? Well, IOA helps the most with believability because if two people are measuring the same thing and getting the same outcome, at least that data is believable. It might not be accurate, it might not be valid, and it might not even be reliable, but if multiple people are measuring the same thing, at least it's believable. So if they're gathering IOA data, the aspect of data that it helps most with is believability. Lainey is a Pilates instructor at Core. Lainey teaches different classes, both individual and group. The individual classes are 30 minutes and cost $75, while the group classes are 1 hour and cost $150. Lainey makes way more money from the group classes, so she always elects to teach group when she can. What idea is most described here? Well, let's think about Lainey's behavior, right? And what idea are we reflecting? We have a situation where Lainey has two different classes. One, she gets paid way more money. So she gets paid way more money here than here. Now, she's always electing to teach this class. Why? Well, she's getting more reinforcement. And so when we have a situation where we have, let's say, two behaviors or two potential options available, and behavior tends to go to the one where reinforcement is, what do we call that? A, behavior momentum. This is not necessarily behavior momentum. We're not talking about high probability sequences here. What we're talking about is matching law. Behavior tends to happen with the same ratio of reinforcement, or behavior tends to go where reinforcement is. If Lainey is making more money from group classes, it makes sense that she's teaching more group classes. Behavior contrast has to do with different schedules in different environments, causing different changes in behavior, right? And we're not dealing with behavior contrast here. And then resistance to extinction. We're not discussing extinction. We're simply saying Lainey is getting reinforced in two places, but she's getting reinforced more in one, so she's going more to that place. And matching law is what would describe that behavior. In an experiment assessing the impact of reading intervention, the assessment tool's scoring criteria are changed halfway through the study to improve accuracy and reliability of data collection. This change potentially affects the study's internal validity through which of the following threats. When we have a threat to internal validity, we are talking about our functional control. Are we affecting the behavior with our intervention? In this case, what's changed, right? Because with threats, typically things are changing. So what's changed here, right? Well, the assessment scoring criteria has changed. So we're changing how we're collecting our data. Now, what threat does that match? A, maturation. Maturation has to do with the natural development and growth of participants. We're talking about the assessment and the data collection. B, history. History has to do with the past and the learning history of the participants. We're talking about data collection. We're talking about instrumentation. We're changing the tool, right? If we change the tool in the middle of the study, data are going to change as well. So those data are going to look different than before. Attrition. Attrition has to do with participants dropping out. We're talking about the tool. We're discussing the change in instrumentation. Megan works from home and is responsible for watching her son when her son does not have school. Her son can be needy and attention-seeking, and he will often interrupt Megan's meetings. Megan starts to give the son $1 if he goes 20 minutes without interrupting her while she's in her office. What type of differential reinforcement does this resemble? So we have a differential reinforcement question, and the first thing we ask is, are we teaching a replacement? Well, what is our target behavior right now? Target behavior is interrupting Megan's meetings. What is Megan reinforcing? She is reinforcing not interrupting. She's not teaching any replacement, but she is reinforcing when a behavior does not happen. So when we reinforce in the absence of a behavior, what do we call that? A, differential reinforcement of incompatible behaviors. Incompatible teaches an alternative. We're not teaching an alternative behavior. We're not teaching a replacement. Megan is reinforcing other behaviors, meaning any behavior that isn't interrupting is getting reinforced. DROs reinforce in the absence of a behavior. And then lower rates and diminishing rates work to systematically reduce the behavior with criterions and limits. Not what Megan has done. Megan just said, if you don't interrupt me for 20 minutes, I will give you reinforcement. So that best describes a differential reinforcement of other behaviors. Sunny's behavior analyst introduced a new reinforcement schedule where Sunny can earn 10 minutes of PlayStation time at the clinic if he works for 15 minutes. At home, Sunny is able to earn 10 minutes of PlayStation time if he works for 45 minutes. If the behavior analyst wants to limit behavior contrast with the new schedule, what should they do? What did we just say behavior contrast is? It's when there are multiple schedules going on in multiple environments. And what typically happens is the behavior will go up or down in one environment and then down or up in the other. They're going opposite directions. In this case, if Sunny is earning 10 minutes of PlayStation time on an FI 15 here, and then an FI 45 here gets the same reinforcement, well, those are very far apart. So when he leaves this environment and goes here, he's learning that after 15 minutes, I should get reinforcement. Here, it's going to be 45, and that schedule's been faded a lot. So behavior might look very different given the difference in schedules. So what should we do? A, remove the contingency altogether. Well, no, we can take less drastic steps first. B, add a punishment procedure at home. We first want to address the issue of the reinforcement schedule before jumping to punishment. C, add a punishment procedure at the clinic. Same thing. Let's address the reinforcement issue first. D, work with the home schedule to make it closer to the clinic schedule. Yes, if we just changed this, ideally to FI 15, but even if this went to an FI 20, at least that's closer, where the behavior is meeting the same consequence at about the same time. That's going to be the best way to limit behavior contrast, is try to match your plans in different contexts and environments. A behavior analyst aims to teach a client how to assemble furniture by demonstrating each step while the client observes. After the demonstration, the analyst wants the client to immediately perform the steps themselves. The client struggles with certain steps, so the analyst provides physical guidance on those specific parts while gradually reducing assistance as the client becomes more proficient. Which combination of techniques is the behavior analyst attempting in this scenario? Long question with multiple answers, right? Because we're looking at a combination of techniques. Let's start with what we know. Let's attack the question. Don't go to the answer choices yet. The analyst is teaching furniture by demonstrating steps. So the analyst is modeling. The analyst wants the client to immediately perform the steps. So the analyst wants the client to imitate. The analyst is modeling. So we can reliably say that our first technique is modeling. What do we know next? Next, the client struggles with certain steps. So physical guidance is provided, so some sort of physical prompting, but that physical guidance is reduced as the client becomes more proficient. So we're giving physical guidance as needed and then fading it quickly, which sounds like graduated guidance. So let's look at A, modeling and shaping. Modeling, yes, but shaping, we never talked about approximations, so it doesn't appear to be shaping. B, imitating and task chaining. The analyst is not imitating, they're modeling. C, modeling and least to most prompting. The analyst is modeling, but they're using physical guidance. So they're not using least to most prompting, but rather most to least or some variation. D, modeling and graduated guidance. Yes, the analyst is trying to model, and then they're using graduated guidance as their prompting strategy. Tori is happy with how her first parent training session turned out. Tori has been on the case only a couple of weeks, but believes the parents picked up on the extinction procedure very quickly. Tori went to supervise last week and noticed the parents were doing something completely different than what they were trained on. What are Tori's options on response to what occurred? Now, I have a situation where Tori has to choose what to do, and we've got to use all the information to respond to what occurred in the situation, right? So what does the question give us? Well, we know it was her first parent training session. She's only been there a couple of weeks, but the parents are not doing what they learned. So what are her options? It's very important to note, one training session, only a couple of weeks. A, Tori should schedule another parent training and retrain parents on the procedure. That's the most obvious answer, right? She's only had one parent training session, only been there a couple of weeks. It's not unusual for them to not pick it up the first time. B, Tori should consult with the parents during the session to make sure they understand the plan correctly. Sure, Tori's there. Might as well talk it out and clear up any confusion right then and there. C, Tori can discharge the client and services due to the parents failing to follow the plan. We are not yet at a point where Tori can justify termination given it's one session, one training session, and only a couple of weeks. Tori needs to do more before she jumps to getting rid of the client because the parents aren't following the plan. He's only done one session. Maybe the training session wasn't good, right? There are steps she needs to take first before discharging the client. So our answer here is going to be both A and B. Thanks for watching. Please subscribe, share, and like. Check out behavioranalyststudy.com for all of our study materials. When you pass, let us know so we can include you in the Sunday shout out. Work hard, study hard. See you soon.